Good afternoon, everyone, and thank you for joining us for this session of the University of Calgary's webinar series that aims to address the challenges we're facing day to day during the coronavirus pandemic. I'm your moderator for today's session, and I am Deborah Yedlin. I'm the Chancellor of the University of Calgary. If you've joined us previously, welcome back, and to all our new viewers, thank you for tuning in to be with us today. In this time of uncertainty, the University of Calgary, like many other individuals and organizations, have adjusted to the new world order. We have moved classes and almost all operations online, and as we've done this, we've taken steps to support our students and protect the academic experience. In addition to supporting our students, it is important to us that in such a troubled time, the university not retreat inward, but instead engage broadly with the community, offering information and helping connect those in need with those that have the capacity to help. We are here to support our community through this unprecedented time and share the knowledge of our scholars who are experts in their fields. Two of these experts we will be talking to today. They are Dr. Sheri Madigan and Dr. Nicole Racine. They will discuss strategies for promoting parent and child well-being during COVID-19 and recognizing the signs of child stress. Please submit your questions through the Q&A feature and we'll answer as many as possible after they finish their presentation. With schools all over the country closed, many families hunkered down at home helping to plank the curve. Students are trying their hand at virtual learning and navigating a different everyday life. At the same time, many parents are taking on the role of teacher, coach, therapist, and much more. And this can be overwhelming for parents and children alike, and I look forward to hearing from our panelists on how to best handle these stressors. So as I said, please submit your questions using the Q&A feature and we'll get to them when we can at the end of the presentation. And if you have to leave early, don't worry about missing the webinar. It will be available on demand and we will email you a link as soon as it is available. So I'd now like to introduce our presenters today. Dr. Sheri Madigan is a clinical psychologist, associate professor, and the Canada Research Chair in Determinants of Child Development in the Faculty of Arts and the Werco Center at the Alberta Children's Hospital Research Institute. Our second presenter joining Dr. Madigan is Dr. Nicole Racine, who is a clinical psychologist and an Alberta Innovates postdoctoral fellow in the Department of Psychology at the University of Calgary and the Alberta Children's Hospital Research Institute. Welcome to you both. I will now turn it over to you for your presentation.
Great, so thank you for having us and thank you to everyone for being here today. We're really excited to have so many people online with us, and certainly we know that there's a lot of collective wisdom in the room from all the parents and caregivers who are here. So we're really looking forward to co-learning together. The main goal of our webinar today is to give a sense of the science behind stress, review some of the signs and symptoms that we may see in our children related to stress as a result of COVID-19, and then most importantly, identify factors that promote coping and resilience in families and in children. So over the last month or so, certainly families, parents, and children have been experiencing high levels of stress. And some of these have come as a result of a number of different experiences related to COVID-19. So we've seen disruptions in routine as a result of parents working from home, school and childcare closures, financial stress associated with many parents and caregivers being laid off, and then increased social isolation as a result of social distancing. And all of these things together are contributing to higher levels of fear and anxiety and a resulting increase in stress in Albertan families. From what we know of the science of stress, what it really represents is a mismatch between demands that we're experiencing and our perceived resources. And so what I mean by that is when we are experiencing too many demands and we don't really think that we're able to cope based on the resources that we have, that's when we experience stress. And so stress is important. It's telling us, it's a bodily response telling us that we need to respond in one of two ways. So first, we need to reduce demands where possible. And then we need to try and increase the resources around us. And what we hope to address today is how we can help to do that. Now, the Harvard Center for the Developing Child has put out this really great graphic, and we've included it here because we want to illustrate some of the different types of stress that children can experience. And often when we think of the word stress, we have a negative connotation, right? But in fact, stress can be a good thing, especially if it's positive stress. And these are the types of stressors where we may experience elevations in our body, but we're able to overcome these things. So as you can see in the graphic here, you see the child is kind of hopping over that first green boulder. And that's an example of, say, meeting a new person or taking a test at school. Now, in the second example, which we call tolerable stress, these are stressors that may be a little bit bigger, but they are overcome with the help and support of loving family and caregivers. And so what we see in this image here is, in fact, a parent throwing down a line rope to a child. And we like to think about COVID-19 as being a tolerable stress, especially in situations where we have supportive parents and caregivers. And we're going to talk a little bit about that, about how we can provide that. And then the last source of stress is one that we're a lot more concerned about. This is toxic stress. And often these are experiences of abuse, neglect, perhaps parental addiction. These are actually the types of stress we spend a lot of time researching and trying to understand a little bit about. And what makes these stressors toxic is the absence of caregivers or parents or people to help that child overcome them. And so what we're hoping to focus on in the upcoming slides and in the Q&A is really how we can support children so that COVID-19 really does feel like a tolerable stressor. So next, we're going to highlight some signs and symptoms of stress in children and adolescents. And we talk a little bit about these depending on age, because it can look different depending on the age of your child. So in young children, stressors can look like disruptions in sleep or bad dreams. So often in quite young children, we'll see emotional or behavioral responses. This might be an increased need for closeness, fear of being alone, maybe some disruptive behavior, and then being more emotionally sensitive. And one of the reasons for some of these behaviors is, in fact, that in really young kids, their stress system is activated, and what they are needing to do is signal to their caregiver that, in fact, they need proximity and they need to be close for their own safety. So these types of behaviors that we're seeing are adaptive. In children who are a little bit older, so say around school age, between 6 and 12 years of age, again, we may see shifts in sleep, perhaps an increase in nightmares, also maybe complaints about physical symptoms, so things like a headache or a stomach ache, withdrawal from family and friends, difficulties paying attention, again, seeing a little bit more sensitivity, perhaps more easily upset, or difficulty navigating situations that typically wouldn't be very challenging. We may see regressions in things like bedwetting or using baby talk or wanting to do things that would be for children of younger ages. And then perhaps increased irritability. And then lastly, in our teens, some of the signs and symptoms that we may see could include, similar to children who are a little bit younger than them, some of those physical symptoms, maybe changes in sleep or appetite. So you may see actually challenges with sleep onset, falling asleep, or sleep maintenance, being able to stay asleep. Again, some of that agitation and irritability or decreases in energy. And then isolating from peers. And this would be above and beyond what we would be expecting from social distancing. This would be really a removal away from interacting with peers.
So what we want to talk about sort of in the latter half of this presentation is really the concept of resilience, because although we see these stressors, what we know is that we can pull children out of these stressors or buffer children from some of these stressors, especially when we can be supportive caregivers to our kids. So there's a concept that we often study in the same way we study adversity. We also study the concept of resilience in a lot of our research. And what you can see is that resilience here is really the adaptation in the face of adversity. So children's adaptation to adversity is not necessarily an individual trait or characteristic, but it actually reflects the capacity of an individual to adapt to challenges based on their connection to other people and systems around them. So if there's one big takeaway from this talk, it would really be that as parents, we can be that buffering support to our kids. And when that buffering support is there, we actually see kids can be remarkably resilient when they're faced with adversity. There's a nice sort of slide here to really just illustrate that as children can experience a variety of negative experiences, and this might be COVID-19 as well. These may be difficult experiences for them because of all of the sort of sacrifices that they might have to make by socially distancing, for example. But what you can see is that if they're in the presence of several positive supports, which is really the parents and other supportive caregivers and friends and family, what we can see is that those positive supports can offset any of those negative experiences for kids. So there's a variety of different ways that we can provide, be that buffering supports to our kids or promote resilience in kids. And we just give a few examples here. Of course, a big one is patience, tolerance, and reassurance. That means we need to sit down with our children and have supportive discussions, listen to our kids and hear what their concerns are, and really be open-minded to having sort of real talks with them about what's happening, and be as helpful as we can in terms of problem solving with them some of the struggles that they're dealing with. We also know that engaging in calming activities, across all different ages can be really helpful. And so too can having routines. So, we want kids to wake up in the morning, get dressed, have their breakfast like they normally would as if they're going to school. And many schools have sent out a suggested schedule for kids' daily activities, which includes some, physical activity as well as doing some homework and some designated work time. And so we really suggest that as much as possible, we maintain those routines at home. That includes routines around sleeping and eating as well, because we know that those routines can be really helpful for kids in terms of being able to predict and understand what's going on in their environment. And lastly, we just suggest here as a way to kind of help kids is actually to reduce a significant amount of media exposure, especially for really young kids. It can be really easy to gravitate towards the news and have the news on in the background, and much of the news right now is alarming. And what the research shows is that when kids are exposed to a lot of that alarming television, that they actually do show greater signs of stress. So we should try and turn off the TV, no background TV on when it's the news, and also just really try to reduce any alarming media exposure for kids. And then we have a few other ideas here to reduce stress and coping. And one is really just keeping social connectedness with friends and family. I've heard of lots of people doing a variety of different chats with friends and family that they didn't used to do before. This is a great way to stay connected both for parents, but also for kids. Of course, we want to get as much outdoor time as we can. That involves a lot of walking right now and running and outdoor activities, but we certainly really want to promote that. We know physical activity can be really healthy for kids' brains and bodies. You could sit down and problem solve activities and routines and projects with your kids. You could come up with a schedule together so that you're on the same page, and so that it might be easier to execute that as a family. Certainly explore online resources. This is a time where we can actually, always have that, your child might have had that skill they've always wanted to learn, for example, chess or drawing. There's a variety of different online resources where they might be able to actually explore some sides of themselves that they haven't been able to do before in terms of skill building. And then lastly, as a family, as parents, we should practice gratitude and mindfulness. And then, can really help children become helpers and engage in the caremongering movement. So while we're social distancing here in Calgary, there's still snow falling on the ground. So we could go out and shovel, make sure that the neighbors, alleyways clean or tidied up or shoveled so that they can walk along the alleyway, for example. So we want to, there's lots of things we can do while still social distancing that involve really teaching kids about compassion and empathy for others. And then, lastly, there's a variety of different coping strategies for parents. So in the same way we are suggesting some coping strategies for kids, because obviously this is a very stressful time for parents. So we've gone from working, for example, to having to work from home during a crisis, which is very different. And or we have more children at home that we're used to, and so you're juggling a lot more tasks than typical in the day. So these are just some suggestions to really help you as a parent. So that means engaging in some self-compassion, maintaining your own routines, really trying to set a little bit of time aside for yourself every day to do some of the things that make you happy or that sort of refill your cup, essentially. And of course, engage in some social support. So, you want to draw on your own resources and support to make sure that you have the coping strategies that you need to get by during this difficult time. And lastly, we suggest, really setting realistic expectations. So it's really different to work from home and parent and all of a sudden become a teacher and have to be the person who's teaching your kids. So I think setting realistic expectations of what we can accomplish in a day is really important. And once we have those realistic expectations, we tend to feel a little bit better because we've been able to meet them instead of letting ourselves down because we didn't achieve all the goals that we had unrealistically set out for ourselves in the day. So we encourage you really to just think about what your most effective health, self-care strategy is. So this looks a little bit different for everybody, but if you can think of what that is for you and try to implement in your daily routine, we know that can be a really important resource for parents. And if we just have one example that we've done here. There's lots of good ones online, but engaging in self-care is a huge protective factor for parents. And so we have this self-care wheel here where you can actually draw out some supports for yourself and think about how across these various domains you might be able to achieve self-care throughout the day. And the last thing we'll say until we get to the Q&A is really to remember that you can't pour from an empty cup. So, you really need to have your own cup full, which is why we're trying to emphasize that you take care of yourself as a parent, that you fill up your resources as a parent so that, you can have a little bit of overfill on this cup so that you can actually give that towards others and towards the kids. So self-care really, self-care is certainly not selfish. It's very much essential and necessary. And then, so just in summary, some concluding statements is that children can experience stress related to changes and shifts in their environment, and this can include the experiences they're having right now because of COVID-19, that there are a variety of coping strategies and supports that can help parents, but can also help children. And we know that when these are in place, they can actually buffer us from, or not only us, but our children from stress. And then lastly, that parent stress reduction and self-care are really important priorities. And so one more takeaway from this talk, if you can, is really to prioritize yourself and some time for yourself throughout the day to fill up that cup so that, you can more effectively give to others during your day. So I think we'll take some questions.
Thank you very much for your presentation. And we already have some questions online. And speaking to the thing you just finished with, Sheri, Dr. Madigan, one question is, I feel like I'm not doing a great job as a parent. I'm wondering how to cope with the pressure of teaching and my kids' development alongside my own need to work, rest, and deal with the other issues going on. Clearly, speaking to the last segment of your presentation, how do we get to that, I guess, self-compassion, that self-care, and try and find that balance as parents?
Yeah, well, I think in the same way we prioritize feeding our kids and getting them, you know, into routines and sleeping in school, I think we need to carve out a little piece for our day that really is about that self-care and self-compassion. And while that can be hard to do, I mean, a first step today would be to find the time to make that plan and to really try to sit down and just see, you know, what are the things I can do throughout, you know, throughout the day that give me that break that I need, or that fill up my cup, or who could I really count on, you know, when I'm really struggling as a parent, who's my go-to person that I could call, that I could text, that would really help me sort of get over this difficult time in this moment. So just really thinking about what we need as parents to be able to get through those hard times. And if you can carve out a little space today to figure out what that is, and then it's a lot easier to implement that, I think, as the next days and weeks go by.
So just as a follow-up to that, I mean, I think it may be harder for parents who are working from home because the lines are blurred between home and work. And so they're drawn into their work and they have the ongoing demands at home. So how do you suggest setting those boundaries so that you don't sort of drift back into your work when you actually know that it could be not postponed, but just sort of you can take a break from that as well. I think it's a tough balance because you don't get away from it. You can't leave the office. Your office is everywhere in your house, wherever you choose to be working right now.
Yeah, I think one strategy for that in talking to friends and colleagues is really to set up a schedule. And if you have a partner at home, certainly set up a schedule with your partner and have designated work hours, I think can be quite helpful. So in the same way we've talked about predictability around routines and schedules for kids, we also need that for ourselves. And so I know in my home, as I'm navigating, you know, my husband and I both work. We have 4 children at home, 2 of whom are supposed to be in school right now. You know, one of the things we've done is have very set times where we work, and we try to really stick to those. I book my meetings during those times, really to try to respect sort of both of our schedules. And then the kids are also have very predictable schedules. So I think that predictability can be very helpful. I'm sure Nicole has some other suggestions.
I think it's important for us to remember these are such extenuating circumstances. And I think it's easy to have really high expectations for ourselves. And I think just considering that right now isn't when we need to be perfect parents or perfect employees. We need to be good enough. And I think, you know, keeping that in mind that, you know, there probably will be things that fall through the cracks, and there may be ways in which we feel like we're not doing our best job. But that's okay. That's normal. That's actually everybody right now. And I think, you know, keeping that in mind is really important.
Yeah, it's certainly. Oh, sorry.
No, go ahead.
No, just something that I think is really important that Nicole said is just, you know, no one's alone in feeling that way. And I think in so many people that we've talked to is there's a real struggle in terms of feeling like you could accomplish what you'd like to accomplish. And I think lowering our expectations for what we can get done in the day actually would be a welcome relief to many parents out there.
So no surprise, a couple of questions about teenagers and how to manage them. So one question being, how do you force a 17-year-old to do things you know are healthy for them, but they refuse to do? For example, get out for a walk and take a break from video games and screen time. With another one being, you know, how do you manage those teenagers who actually want to leave and spend time with their friends and might do that when you're sleeping?
Do you want to take this one, Nicole?
Well, I can start with that in terms of, you know, the motivational piece around how do you motivate a 17-year-old to do things that are healthy for them that maybe they, you know, might not see as being important. I think most parents of teenagers will know that simply telling them to do it or nagging them is largely ineffective. One thing that we like to recommend is in noticing, say, you know, if your teen says something like, oh, you know, like I'm not feeling that great today. I'm feeling, you know, kind of low energy, and saying, well, you know, like I've kind of been noticing that you've been spending a lot of time playing video games. Like, how's that working for you? trying to ask them questions about what are the things about what they are doing that's working well, and then maybe the things that aren't working so well, and guide them in a way to their own conclusion, to the point where they might be like, like, I feel like I just need to get out for a walk. And you can be like, oh, that's a great idea. I hadn't thought of that. Maybe I can go with you. And so these are kind of some of the mind tricks of dealing with teens that can be helpful.
I think also information can be a really powerful tool for teens. So, I've pulled out the graphs and showed them a lot of the evidence around what we know in terms of why social distancing is working, how that flattens the curve. So even heading over to the Government of Alberta website is tracking cases and actually demonstrating how many positive cases are due to community transmission versus travel, and I think giving teens information about how that community transmission can actually flatten if we all engage in social distancing, why this is important, and talking through some of the cases that have happened, I think, where children in that age range between 20 and 45, there's quite a substantial number of people who are really struggling with COVID-19 and some of the symptoms. So being able to give them some realistic feedback around that, even teens can really struggle with some of these symptoms. They're certainly not, not going to go through it if they get COVID-19 and not struggle at all. So I think information can actually be a really powerful tool.
What kinds of strategies can we use for our children that don't involve a screen in order for parents to get some space and to get some quiet, maybe to get some work done, so they're occupied in quote unquote a healthy way, as opposed to one that is very passive in one way by, whether they're doing video games or just watching something online?
So, I think that I think a lot of parents are feeling a bit guilty around giving screens. So I'm happy to address the no screens part of it. I do think it's important to talk about allowing kids to use screens and giving parents that time to actually themselves have a little bit of a break. So we know that screen time in small doses is actually not problematic for children's development. And so parents should feel like that's an okay solution, is to give kids screens. It's a long day. We've got a lot of demands on us, and it's okay to actually default to screens throughout the day. It's when kids are on screens hours and hours continuously a day where we know that can be a bit more problematic for children's development. But as Nicole said, these are exceptional times and we have to make some exceptional decisions around how to manage our day. I think, outside of screens, some strategies that parents could use, what I would do is actually sit down with kids and say, what are you interested in? What would you like to do? So get kids to brainstorm some ideas about what they're interested in, and kind of listen to, maybe they're interested in arts and crafts, learning how to play chess, whatever it is. And then what you can do, as Nicole was saying, with some mind tricks is, it basically gets them to buy in because they've been part of the generation process of these ideas. And then you can be the facilitator to be able to help them execute some of those. So whether that's arts and crafts or outside time or learning a new skill and a new instrument, for example, or something, if the kids are part of the brainstorming for that, you might get more buy-in.
What do you recommend for families where there's high conflict and the kids are anxious and afraid of what's going on? Like, I think if you're in a high conflict situation, that is already a challenge. And then if there's anxiety and fear around the environmental situation outside the home, that adds to both the anxiety and the fear. What should families do to do what's best for the family unit and for the children?
Yeah, I'll let Nicole take that one.
Yeah, so those are what you're describing are really challenging situations. And certainly we know these are actually the kids who we're most worried about right now. So ones who maybe are in environments that may not be as healthy and safe. And so, if this is your home or your environment, I think it's really important to consider the impact that may be having on kids. And so, as much as possible, reducing exposure to that high level of conflict. And so, there are a number of things to consider in that. So maybe that is simply that, like there's lots of breaks throughout the day involved, spending time apart, spending time outside, things like that. And then, if it's a situation where things may be unsafe, then I think larger measures may need to be taken into consideration. But I wouldn't underestimate the influence that can have on children. And certainly it's something that we want to consider.
I think too, if families are struggling with that right now, our family physicians are still there. We can give them a call. They're more equipped with, they're equipped with knowledge around resources, around telehealth. You might be able to connect with individuals who can help you through some more difficult times. So you can also draw, in the same way we said, draw on social supports within your immediate environment. Your family physician is one of those social supports. So draw on your family physician and see if you can gain resources to help kids. It might be through telehealth, so it might be through a connection with, say, for example, psychologists or therapists virtually, but I think that can be really helpful for families as well.
We're getting a lot of questions from parents about how they have to fulfill the role of parent and teacher, and how to balance their workload, but also make sure that their kids are doing the schoolwork that they need. Some are expressing frustration in terms of the amount of homework that's coming. How do you advise parents dealing with these kinds of different challenges on their time and their attention? Is there sort of, you said, because you both said good enough. What's good enough?
Well, I'll tell you, when I got the schedule from the school, what I saw is that there's only about an hour of homework expected of my middle school children a day. And so, that sort of gave me a whole lot of relief, because I thought I had to be teacher all day, but in fact, I only really need to be teacher for very small bits of the day. And again, carving out that routine has certainly been very helpful in our house to get that homework done. But I think that also speaks to the expectations we're placing on ourselves. We shouldn't need to be teacher all day. Actually, we should just need to be teacher for, some half an hour segments throughout the day. That's achievable for the kids and also achievable for us as parents. So again, I think we can draw back on the expectations that we're placing on ourselves. And if you feel the expectations are too high, or you're getting too much homework that needs to be done with kids, then I think the teachers are there to have a virtual conversation or to speak with them about how you can't meet those expectations. So we would suggest that children might get, children who are really struggling to get that done, the teacher might carve out a little bit less homework for them that's more achievable, because we need to set kids up for success, and that means that they can get that work done. And if it's overwhelming kids and overwhelming parents, then the risk is that they just won't do it at all. So I think a conversation with the teacher around what's feasible for the family and for the child to accomplish is a really important discussion that I'm sure a lot of teachers are willing to have.
And the other thing is, you need to remember that learning happens in multiple contexts, and
right.
The learning curriculum is one way to learn, but there are many other learnings that can come from being at home and being around parents and being with siblings that are actually really important life skills. And so I wouldn't discount any of those things as being pretty significant and important learning opportunities for children. And I think if we reflect back on any other, major world events, like, with World War II, no one ever said, what was really unfortunate was when, the kids didn't learn anything in school. And then, an entire generation of children were behind academically. That's, I think, less of a concern. I think what we really need to focus on is, if kids come out of this having some good coping strategies for stress and anxiety, I feel like that would be a win. And so let's consider that too.
So another theme that's no surprise is the sort of the anxiety piece, you know, everything from a 3-year-old who wants to know why they can't do things to kids who are being shown data from a website from the World Health Organization showing the number of deaths in a country. How do you, how do you manage the anxiety across the spectrum? Because, you know, obviously the 3-year-old needs some information. The 10-year-old, say, needs a different kind of information. This is really a challenge, I think, because everybody has a different level of anxiety, and the kid, it needs to be validated, but it needs to be addressed and mitigated or as best possible. Do you have some suggestions in that regard?
Yeah, so I think it's really important to tailor your conversations with the kids to really fit the developmental needs or the age of that child. So we would have different recommendations for how you talk to kids about COVID-19 and what's happening in the world and the pandemic based on how old that child was. So really under the age of 3, there's not going to be that much absorption of any material around COVID-19. They're just going to wonder why everybody's home all the time and possibly be delighted by the amount of family members at home. Kids between the ages of 3 and 6, they're going to have a bit more capacity for understanding what's happening. So what you can do with kids that age is something, and especially if they're showing anxiety, you can give them some information about what COVID-19 is in really simple language, like, there's a bug that's going around, it's a germ, and this germ can, if we touch the germ on a surface and then we put our hands in our face or in our nose, we're more likely to catch that germ. And that germ can make us sick, but it can also make grandma and grandpa really sick if we share it with them. So we're trying to be really careful by staying at home and avoiding places like the grocery store and the play structures, because that's where germs live right now. So just kind of making that really understandable for them. And then for kids over the age of 6, we often use the phrase, you've got to name it to tame it. So they really need to understand what COVID-19 is, what are the risks associated with it, and give them some knowledge in order to tame some of their anxieties. So that would mean, telling them what it is, telling them it's making people sick. And yes, some people are dying from it. Most of the time, the statistics show that's older people. However, that we still need to be careful. And we do that by washing our hands, by avoiding places right now where the germs might be sitting, and by really sticking together as a family in our house. And we know that if we follow those, it's likely going to keep us safe. So I think, and of course, with older teens, you can have a more frank and overt conversation with them. But so I just was trying to illustrate how you would change your language based on the needs of kids or the ages of kids.
How do you suggest parenting? I mean, we're talking about at a time of social distancing. How do we? What suggestions do you have about when you have a custody arrangement and your child or children are spending some time with one parent and another? What kind of ground rules do you need to set in place? For example, let's say a quarantine situation all of a sudden arises. Can the child go back to the other parent? Do they have to stay there? What do you suggest? Sometimes the rules in one house may be a little different than the rules in the other house. What would you suggest?
Yeah, I'll let Nicole take that one.
Yeah. So, and Sheri and I, we've talked a little bit about this because these are circumstances that certainly come up. And I think, the most important thing in these situations is really to have really good communication and to agree on a plan. And the more that we have, like a plan in place and something that we've talked about in advance, it makes it easier when some of these situations arise than to know what to do. So for example, if you're in a situation where there may be 2 different homes, being able to communicate about, okay, so what's our expectation for each other about what's happening with the child when they're at each person's house? And should there, for example, be a quarantine situation how would we deal with that? And what would then also be our expectations? And so as much as possible, I think having the communication lines open and coming to consensus, trying to be on the same page as much as possible. Certainly, it's not always easy to do that, but the more that we can do it in advance, the easier it makes it if that situation were to arise.
Yeah, we always say that prevention is better than intervention. So, being able to do something preventatively, like Nicole just mentioned, is really a great strategy as a starting point. If families are feeling as though conflict is really high and they can't get on the same page, then there are some resources online, we can share them, but there are some strategies online where you can work through a plan together online, so talk through that plan together, almost as though that online resource is the third party that can work through it, because it's going to give you really the suggestions that we should be following, and it's going to reinforce a lot of the strategies that are being imposed by the government to keep us all safe.
Question about a child who clearly appears to have some challenges with, is stressed by what's going on, has had 6 timeouts today. And just wondering about, you continue to give timeouts, at some point it doesn't work. What else should you do? Obviously it's a sign of anxiety, or I'm thinking that's what it is. And so it's out of character. What do you do to sort of try and help the child decrease the stress level?
Yeah, so what I would suggest in this moment is actually to try to revert another strategy. And I always say, as parents, we're always trying to draw on a variety of different tools from our tool belt. And so timeouts is one tool, but another tool in your tool belt might actually be that child's probably possibly signaling that they actually need some one-on-one attention. So it actually might be sitting down with them and just letting them play in the context of a play situation, and letting them dictate the play, and just actually, as a parent, just be a running commentator, say what's going on, talk to the child, let them lead that play, but actually try to give them a lot of positive reinforcement in the context of play, and that's a very safe environment for them, is to play. And what the parent might see in that is that when they're given that time for positive attention, that there might be less reason to act out because they're getting the positive attention somewhere. So sometimes what we see in timeouts is kids, with misbehaviors, kids are really trying to signal to something to us, and they signal almost to a very they sometimes go to the opposite place we want them to go, and that's to misbehave in order to get our attention. So I recommend trying to give positive attention in the context of play, to see if that can offset some of those more problematic behaviors as one tool in the tool belt.
And when you see what you want to be seeing, praise it, because the research shows that even simply adding that praise and adding the positive attention through the one-on-one play automatically leads to decreases in some of the behaviors we don't want to see as much of. And so that certainly bears itself out in the research.
Somebody's asking, would you consider it a sign of stress if the kids are bickering and arguing with their siblings more than usual? Any tips for parents, or do we just let them figure it out on their own life skills, or do we intervene?
I mean, that's a good question. One I've been dealing with on a personal level as well. And so I think that, again, information can be really powerful. So I recommend sitting down and talking with the siblings, kind of reiterating that they are each other's playmates right now, and that they can make this an experience that can be a good experience. They can rely on each other. They can be each other's social support, and how can the parents help them make that happen? So sort of be a facilitator to try to really promote more positive sibling interactions. And so I think that information can be really helpful. And again, problem solving with the siblings. What would you both like to do that you would both enjoy together? So trying to find some common areas or aspects or activities that they enjoy together, and prioritizing those, so that that might be an opportunity for that sibling relationship to to thrive a little bit. And then, as Nicole just mentioned, when you do see really positive interactions with siblings, I think it's really important to note that for them and say, gosh, you guys are doing so, you know, guys are being such good supports to one another. That's going to really help you through this time. So I think just, you know, a few strategies, but it's not easy, and I can verify that it's difficult to get siblings working together. But I think that you know, lots of chats with them will certainly be helpful.
There's just a question, a request came up. If you could post the the resources for dealing with negotiating with the for better communication if there's a split household. If you could post those, that would be appreciated. And in that regard, there's another question that's come up: separated parents, lack of communication. What if the homeschooling expectations are different in the two houses? How do you avoid more conflict?
Well, Nicole sort of talked about the last question, so maybe I'll let her.
Sure. You know, and I think it's when we were talking about, you know, having increased communication and having these fantastic plans, certainly those aren't, it's not always the case. And the reality is that often these situations can be quite challenging. You know, if the expectation seems to be different in one household versus the other, I think there's, you know, the possibility of having a conversation about that. And if that doesn't seem to be working, you know, as we said, it's sounding like about an hour a day is the expectation around schoolwork. So even, you know, if your child is at your partner's house and doing reading or, you know, watching something that's educational, I think these are situations where, you know, escalating a conflict or an argument over things that perhaps at the end of the day may not be make or break. I think it's important to consider these types of things, and we know this isn't the rest of our lives. This is, you know, a crisis situation, and so I would honestly say I think that it's okay for there to be some adjustments in some of the expectations. And then perhaps, you know, if there's something that you want to add on when the child is with you, that would be up to you. Sheri, I'm not sure if there's anything else you want to add to that.
No, I think that's great.
What about, you know, how do you deal with, you know, kids that are isolating and they don't want to connect with their friends? How do you help them connect? Are there exceptions? Do you encourage maybe connection with the friends, but they socially distance and they go for a walk and maybe use a hockey stick to go for a walk so you know you're at the right distance? I guess, how can you facilitate that connection so that they don't feel so isolated?
Yeah, I mean, I think that's a really important question. And I think that it's going to be different based on the individual needs of kids. So I think, again, sitting down and talking to the kids about what they would like, what would work for them. Perhaps, you know, kids these days, they're online all the time. So they might enjoy, you know, a Skype chat or a FaceTime chat with someone. You might want to find out who those someones are for them. So who are their sort of top 3 people they would talk to, and then encourage them to connect with them. You know, if they're having a hard time initiating that conversation, you could get the other parents involved and just say, could you get so-and-so to give them a call? You know, that'd be really helpful right now. So I think you can sort of be the mediator for that. And then, you know, I think getting kids together, even with a hockey stick, is asking them a lot, not just practically, but also, you know, just, you know, in terms of encouraging family members to follow some of the guidelines that we've been suggested. So if you want to go on that walk with them and you can ensure that social distance, I mean, that's a choice I would leave up to parents, but I think you'd really want to make sure that, you know, we are all engaging in the social distancing that's been recommended to us.
Question about resources for families. Do you know of any who have children with disabilities, and that includes the time or the need for respite care so that they can balance what they have to balance for themselves and for their children?
I don't know of any in particular, and I will turn it over to Nicole, except we can send out a resource where there's a researcher, Dr. Carly McMorris at the University of Calgary, who actually does research on children with developmental disabilities, and she's actually collated a list of resources. So what I can do is she's put that on her webpage, so I can certainly send that out. We can send that out when we send out some of the other links, if that would be helpful. But maybe Nicole is more aware of some.
I think that's perfect, and I think, you know, only just to highlight too that that is losing respite care and not having that is especially challenging. We know so many families who are really experiencing a hard time related to that, and so, you know, as much as possible, trying to fit in a little bit of that self-care for yourself, because certainly that's really challenging.
How about families where they're used to having the extended support of the extended family, whether it's grandparents, aunts, etc., aunts and uncles for relief, and now they're living obviously in separate houses. From a culture perspective, the family norms have been disrupted, and that affects the kids too. They don't see the grandparents, they don't see their aunts and uncles, cousins, but the support's also obviously been is also important. What do you suggest? Maybe you can talk to Dina Henshaw's cohort family idea in this, in answering this too.
Yeah, do you want to speak to it, Nicole, or?
I was just off the bat was just I'll let you talk a little bit about the cohort families, Sheri, but just this idea, we're happy to provide some resources. There are a lot out there that are providing some good information about with the, say like with FaceTime or Skype, how to really make the most of some of those social interactions. So, you know, with young kids, it can be like sharing a snack together, doing a song together, having the child read a book to the grandparent over FaceTime or Skype. I've even seen some examples of grandparents who are providing a lesson to a child about something and really getting engaged in kind of the homeschool piece or component. And so I think when we're used to seeing people in person and face to face all the time, we're perhaps less apt to think about, you know, what it might look like to do that online. But there really are some creative ways to help foster that. And certainly as someone whose family isn't in the same province, I've had to resort to a lot of those different things to help maintain connection with family members. So those can be helpful, and we'll post those.
I think one thing that comes from you know, having family members around is them helping offset some of the meal prep and some of the food, and actually helping with some of the day-to-day logistics. And you know, some of that can still happen. I've seen lots of families do meal drop-offs where they end up just, you know, it ends up on their porch, they ring their doorbell, and then you've got a meal. So rotating meals, sharing recipes. There are ways for family members to help who live within the same region in that way. Even though we're physically distancing, doesn't mean that means we have to disconnect or not be helpful. So there's still lots of ways of being helpful. And Dr. Deanna Hinshaw really actually suggested that families in Alberta adopt a cohort family, and that means that if there's another family that or your family members are in a different household are observing social distancing to the same extent as you and following the recommendations that have been set forth by the government in terms of abiding by the rules around social distancing, that you can become cohort families. So the two families can see each other, their children can play together, but you know, that you need to start off by having a serious conversation about how you're abiding by the social distancing rules, because it really, as Dr. Hinshaw said, it really only works if both families are really engaging seriously in social distancing.
I want to get back to something that's popped up at the beginning of the Q&A. It was about your conversation about perceived resources versus demand. Does that mean we should be assessing our, how do we assess our resources? Is there a way to do that more realistically? Is that changed today versus in a time when we're not self-isolating? Is there a checklist? Are there sort of 3 questions we should ask ourselves to understand if we're out of balance and what we need to do, resource versus demands? Is it lack of sleep? Is it, you know, short temper? Is it?
Yeah. I'll let Nicole take that one because she talked about that slide.
I think I, that those are great questions, really good detailed questions, and I'm not sure that there's necessarily like 3 questions or a questionnaire that I would say this is what you fill out, but I think check in with yourself. And you can kind of think to yourself, like, how am I feeling? Am I feeling overwhelmed? And you can think about the different domains of your life, right? Like related to work, family, self, partner relationship, and there might be others. And if you want to be a little bit more detailed, maybe you can do like a little 0 to 10 for each one. Like, how good am I feeling in each? With 10 being like feeling fantastic and 0 feeling extremely depleted, and then things are not going well. And sometimes doing that little check-in can help just to realize, okay, actually, this is where I think I need to allocate maybe a little bit more resources. So in fact, maybe I'm feeling on top of things at work, but in my partner relationship, I'm actually feeling pretty stressed out, and maybe I need to have spend some time there, or we need to have an open discussion about how we're managing things. And so I think that would probably be the way that I would approach that situation. And for each person, all of this is subjective, right? It's your perceived resources. And then when you're reflecting on, there was that kind of that self-care wheel that we showed, similar to that, when you're thinking about where resources might come from or how you might offset some of those demands or stressors, you can think across those different domains that we showed. So whether that's in social relationships, maybe it's like community, or spirituality, might be physical activity, things like that.
The self-care wheel was also asked to be shared again. So if you could do that, that would be appreciated. Do you have any specific advice for helping children with ADHD and their parents? Because it's difficult, with right now, weather's not great to be active outside. How do you set up the structure and the routine that they need, and give them the ability to blow off some energy too, so they can focus on what they also have to do?
Yeah, I think some suggestions would be to make sure that you sort of reduce the amount of time you're expecting them to do schoolwork. So you should have sort of some achievable time. So if a teacher is recommending 30 minutes with a child with ADHD, you might recommend 15 or 20, and them getting that work done would be sufficient during that time. You obviously want to balance kids with ADHD and any kids really, and that routine is really important. So sticking to that routine and planning that routine, but offsetting some of the time, the downtime with physical activity, getting them moving, certainly having a balanced diet. So all of these are really important, whether they're in school or they're learning at home. So I would suggest those things. I don't know if Nicole, you have any other suggestions for ADHD in particular.
Yeah, I was just going to say on the outdoors piece, I often say there's no such thing as bad weather, just bad gear. And so it doesn't always feel good. And certainly this is an experience we have in my family frequently, where I'm thinking to myself, I sure don't want to go outside right now. But we do, even if it's just for 5 or 10 minutes, just to get that outside air. Half the time, the amount of time it takes to get ready to go outside, there's another 20 minutes. And so, it just is, a good way, even if we think that being outside might not be the best, it's really helpful.
Just one more question about a woman who said there's a teen at home, only child, misses their friends, obviously, because they don't have siblings, and just sort of figure they should just get it over with and get sick. Maybe that's not the best approach. Just we've got less than a minute. Maybe one of you could answer that quickly.
Well, I think that's where that cohort family might come into play. So if they know another family who's also abiding by some pretty strict rules around social distancing, maybe you could get those 2 kids together. That might be a good way. When you're doing that, one of the nice things is that the child gets a change of scenery, because they can go to one house and then the other house. So you might be able to kind of change up that scenery for them, which could be great. So I think that cohort family approach, or connecting them socially with friends, would be really important.
Well, thank you both very, very much for your presentations. I know we still have almost 30 questions that we haven't gotten to today. And I just want to mention that this will be online shortly. And then on Thursday, we're going to be joined again by Dr. Chris Modi and Dr. Gita Van Marl, following on their Popular Faces of COVID-19 webinar last week, where they will be here to answer questions we received, to take more of your questions live. So you can sign up for that webinar and other content by visiting ucalgary.ca/COVID support. Thanks everyone. Thanks to Dr. Madigan and Dr. Racine for their fantastic presentations. See you next time.